Hi everybody and welcome to my channel Speech with Shell. My name's Michelle and I'm a qualified adult speech and language therapist. In today's video I'm going to be demonstrating the movements of an Oro-Motor Assessment. This is an assessment that a speech and language therapist will do when they're assessing how the muscles and the movements of your face work. So firstly, just a brief description of why we do this. There are lots of muscles in the face which are innervated by a range of different cranial nerves. Those cranial nerves send a signal from the brain to the muscle telling it to move. So anyone who might have a brain injury or degeneration of the brain, these muscles can become slower, weaker, less coordinated, have reduced range of movement, or even stop working altogether. Now, since these muscles are vital for speech, swallowing, and our facial expression, the Oro-Motor Assessment, so the assessment of the movements of these muscles, is a vital part of a speech therapy assessment. Now, I'm putting together this video for speech and language therapists who are currently carrying out Oro-Motor assessments in the current COVID-19 pandemic. At the moment, we're visiting patients and assessing them dressed up in full PPE. So it's really difficult for our patients to see what we want them to do when we have a face mask on and our mouth is covered and we have a visor on and this part of our face is also covered. It's really tricky to do. So hopefully, speech and language therapists, you can find this useful to demonstrate to your patients what you want them to do for an Oro-Motor assessment. So without further ado, here are the movements of an Oro-Motor assessment. Therapists, if it's easier, you can pause the video after each movement to give your client time to do the movement. And clients, I'll do the movement first and then I want you to repeat it afterwards. So first, the upper face. I want you to scrunch up these muscles here, so as if you're frowning. Like that. Now I want you to open and close your eyes 3 times. Now I want you to scrunch up your nose as if you smelt something bad, like this. It's quite difficult to do that without moving the rest of your face. Now onto the lips. I want you to purse your lips. Now purse your lips with a ooh. Now I want you to spread your lips like this. Now spread your lips with a ee. Now I want you to alternate between pursing your lips and spreading your lips with the ooh-ee. So like this. Ooh-ee, 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 ooh-ee. Now lip seal. I want you to puff out your cheeks and hold it for a few seconds. Your speech therapist might place a finger on either side of your cheek just to test how strong that lip seal is. Now jaw opening. I want you to open your mouth as wide as you can and say ah. So like this. Ah. The speech therapist might take a pen torch and just have a look inside your mouth. Now I want you to do this again, but this time I want you to place pauses in between the ahs, so you say them 5 times, like this. Ah, 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 ah. This allows your speech therapist to observe the soft palate muscle at the back of your mouth, which should be rising and falling as you're saying those ahs. It's also a good opportunity for the speech therapist to assess your voice quality if they're looking at that as well. Now onto the tongue movements. I want you to stick your tongue out and move it back in and repeat this action like this. You might feel a bit daft, but just stick with it. Now I want you to stick out your tongue and move it side to side like this. The speech therapist is looking at the speed and coordination of the lateral tongue movements. Now I want you to do this, but do it as fast as you can, like this. Now your turn. Now take your tongue up to your nose, down to your chin. Now your therapist is going to place a gloved finger gently on your cheek. I want you to keep your mouth closed and press your tongue on the inside of your cheek against their finger, like this. And here the speech therapist is looking at the strength of the lateral movement of that tongue. Now again, you might feel a bit daft with this one, but I want you to lick all around your lips as if you've got food on your lips. So like this. And then do the same on the inside, as if you've got food stuck inside. These movements are really important for eating and chewing and swallowing. Next, I want you to do a strong cough, sort of as strong as you can. So like this. Here, the speech therapist is looking at the strength of your vocal fold muscles, or vocal cord muscles as you might know them. These are really important in protecting your airway when you're swallowing. Next, your speech therapist will place their hand gently on your Adam's apple area, your larynx here, and I want you to do a dry swallow, so swallow your own saliva. It can be a little bit hard, but try that again. And essentially what your speech therapist is looking for is that up and forward movement of your larynx, because that's what protects your airway and sends the food down the right hole when you're swallowing. And then finally, your therapist might just want to have a look inside your mouth with that pen torch again. They're looking at your teeth. Are you wearing dentures? What the condition of those are, and are they sort of well fitting? They're also going to be looking at the soft tissues inside your mouth to check if they're too dry or if there's too much saliva. And they'll also just be checking to see that there's no infection and signs of lesions and things like that. And that concludes the Oro-Motor Assessment. Therapists, if you like this video, please give it a thumbs up and feel free to subscribe. I have some more videos on my channel and there are more coming as well. So thank you so much for watching and see you again next time.